Dr. Murray here from Absolute Cosmetic Medicine, and I'm here today to talk to you about liposuction and, more importantly, tumescent liposculpture, which is the main method of liposuction that we use here. We've been using it for quite a few years, or performing it for quite a few years, and I think it is an excellent method of liposuction. Basically, we make a small nick in the fat and we fill it up full of fluid. This is called tumescent fluid. It has normal saline, lignocaine and adrenaline in this fluid. Normal saline is just basically salt water, and it'll make the fat runny and mushy or more fluid. So it goes down long, thin cannulas, between 2 and 4 millimeters, on average in diameter. Now, some of the older cannulas were much larger than this, and you've probably seen it on the internet where people ram this through the fat and put a lot of force behind it to break the fat up. With the smaller cannulas, you don't need to do this, and this has quite a few advantages. Number one, it's less traumatic for the body and for the skin. Number two is that you don't get as much rippling and corrugation in the skin as you can with the larger cannulas. But probably the most important thing is that the scars are small or non-existent. And we find that a lot of men, because it's not as obvious after the surgery that they've had liposuction, or not obvious at all, that a lot of men do have it done nowadays. We've been performing this for many years, as I've mentioned. I've done over 4,500 procedures, and we've found the results to be excellent and the risk ratio to be very favourable. The next component of the tumescent fluid is lignocaine, and this is a numbing agent, and it's put into the fat to make it numb, which is great because basically you wake up and you're in no pain at all. The next day though, you will be sore. You'll be about 2 out of 10 intensity and pain, and probably 4 out of 10 stiffness. And a lot of people do mention to us that this is like having a heavy workout, which I think is favourable overall, because most of us have had heavy workouts before. Because you are numb, you only need sedation. Now, sedation is also an advantage, I think. Basically, you have a drip put in the back of your hand, but we do make the back of your hand numb before we do that as well. And you're put in a very deep sleep, but you are breathing on your own. And you wake up quickly, and you can go home under adult supervision that night. You do not need a general anaesthetic. Now, this has a few advantages. General anaesthetics do have a morbidity and mortality rate, but they're also more expensive, and usually you do need to stay in hospital overnight, which once again costs you more in the long run. So lignocaine is great because you're numb, you have sedation, you do not need a general anaesthetic, and you can go home the first night. So it is truly day surgery. The third component of tumescent anaesthesia is adrenaline. Now, adrenaline is great because it means that you don't bleed very much at all. The risk of a blood transfusion is almost nil, and the amount of bruising you get can be cut by up to 90%. So in summary, little or no scarring, little or no bleeding, and no pain during the procedure and immediately after. So these are the advantages of tumescent liposculpture. But with everything in life, there's always advantages and disadvantages, and you must be aware of the complications. Firstly, we start with the rare but serious complications. One of them is reaction to anaesthesia. Now, we measure the lignocaine or the local anaesthetic very carefully so that you do not get toxicity to the local anaesthetic. But general anaesthetic you won't be having a reaction to because you're not getting it. You will be asleep with sedation, which is very light and low risk, but you will not need a general anaesthetic. Perforations or adjacent structure injury, basically with the older, bigger, thicker cannulas, the abdominal wall could be perforated, but with the smaller cannulas this is highly unlikely. Clots in your legs, clots in your lungs, and death, also related to anaesthetics and heavy bleeding of the past, really are also very rare or uncommon now. Surgical revision for loose skin, this is a very important one. Some people do need to have leg lifts, thigh lifts, and tummy tucks after their liposuction, and some people prefer to debulk the fat and avoid the bigger surgery like these, but you must be aware that loose skin is a possibility. To avoid this, we do a thorough assessment of you, and also we put you in a compression garment. This can be worn 2 to 3 weeks all the time, and then 2 to 3 weeks at night, up to 6 weeks all the time. Another advantage of our clinic is we have the latest Vaser 2.0. Now Vaser is a very interesting procedure, and it is basically an ultrasound probe that is put into the fat, and this liquefies the fat but also can help tighten the skin and avoid further lifting surgery in many cases, but not all cases. So Vaser is a very interesting thing to inquire about when you come to our clinic, and I'm very excited about it, and I've been using it a lot lately. Skin damage or skin necrosis or death is possible, and usually you find that with the older cannulas that are big and more brutal to the skin. Shock and blood loss, as mentioned, the adrenaline avoids this. I've never seen anybody bleed heavily after tumescent liposculpture. A repeat procedure, which is extra expense to patient. This can be because some patients would like to get a little bit more fat off than they got off the first time, or they may want to do an adjacent area because the original area that we did is contrasting against the next area, making it to them look worse. Or sometimes you may find that some little areas can be missed, and even though they weren't apparent before, when the worse areas are gone, these smaller areas may stand out a little bit. Need for hospitalisation, also at extra expense to patient. If you do get an infection or you become unwell after the procedure, hospitalisation is a possibility, although extremely rare with this procedure. Seromas or fluid collection around the area can occur, especially in very muscular men, and sometimes it can be seen in Vaser with the ultrasound when it irritates the muscle layer. This is more of a nuisance than anything and does need regular drainage, but these are very, very uncommon. So these are most of the severe complications that are possible but that are rare on average. Then we go to less common but not rare side effects such as waviness and irregularities, asymmetry, left not equaling right, although you must be aware that most people, the left does not equal the right perfectly anyway, infection, pigmentation, tattooing, skin mottling and lumpiness. Now most of these are prevented via the garment that you wear. That will help smooth out the waviness and irregularities, etc. And obviously with infection we prevent this with antibiotic use, and we ask you to be compliant with your antibiotics and make sure that you take them regularly as instructed. As mentioned, most of these side effects are very, very uncommon. The more common complications that are milder, such as severe bruising, swelling, minor irregularities, minor numbness from swelling, and worse scarring than average do occur, but are once again very, very infrequent, and especially with the newer method of tumescent liposculpture. You must be aware that it takes 3 months on average for your final result. It can be as quick as a month, but some people do have to wait up to a year for the full results, and often they're pleased to report that they've gradually improved through the whole year and they've got a great result at the end of it. Probably the most important thing of all of this is to be realistic. This procedure is to give you an improvement, not perfection. The results between 50 to 99% improvement with an 80% average improvement, but possibly it is a possibility that this procedure can fail, so you must be aware, you must be extremely realistic with this. We're looking for improvement, not perfection. It is up to genetics and how well you heal in some cases, although you must be aware it is the most popular cosmetic procedure in the world, and rightly so, because it's such a good procedure. This information is not a substitute for a consultation. There is a lot more that we need to educate you on and inform you in, but don't hesitate to make a complimentary appointment with our nurses, or indeed come and see me. It'll be my pleasure to see you, and I'll go through all these important points carefully with you. My name's Dr. Glenn Murray. Thank you very much for your attention, and don't hesitate to call Absolute Cosmetic Medicine on 9389 9099, or go to our website absolutemakeover.com.au, which has a lot of interesting information on it. Thank you.